Welcome back to Bugs and Beyond, your one-stop shop for everything infectious diseases. Before we jump into today's topic, I always like to take a second to just appreciate something that brings me joy, whether it's a sunny day or a good cup of coffee or just, the fact that we get to explore this amazing world of infectious diseases together. What about you? What are you grateful for today?
Just taking a moment to appreciate the good things, it can really boost our focus and make learning even more enjoyable.
I totally agree.
Okay, now that we've got that positivity flowing, let's dive into today's topic. Intra abdominal infections, or IAIs. Imagine your abdomen, like this bustling city filled with all these vital organs, working together to keep everything running smoothly. But just like in any city, things can go wrong, and that's where IAIs come in. Yeah, that's a great analogy. IAIs occur when an infection develops within the abdomen. Now, we're not just talking about a simple stomach bug here. We're talking about infections that affect the organs themselves, either within the peritoneal cavity, like, think of it like the city's main downtown area, housing your stomach, intestines, liver, and more, or the retroperitoneal space, which is kind of like the outskirts. You find organs like your kidneys and pancreas there.
So different neighborhoods, so to speak, can be affected. But how do doctors even begin to figure out what kind of infection is causing, trouble in this abdominal city?
Well, that's where the detective work of classification comes in. We look at several factors to determine the type of IAI. First, is it complicated or uncomplicated? Think of it like this. A contained fire in a single building is uncomplicated. But if that fire spreads and engulfs the entire block, well, that's complicated. Similarly, if an IAI is limited to a single organ, it's uncomplicated. But if it spreads beyond that, like say from your appendix to your surrounding tissues, we're dealing with a complicated IAI.
That makes sense. So it's not just the infection itself, but also how far it spread that determines the severity.
Exactly. And another important distinction is whether the infection was acquired in the community or in a healthcare setting. A community-acquired IAI is something you might pick up from contaminated food or water, like that nasty bout of food poisoning you got from that street vendor. But a healthcare-associated IAI could develop after surgery, for instance, or during a hospital stay.
So location plays a role too. And this is where it gets even more interesting, right?
Yeah.
Because some IAIs are considered higher risk than others.
Precisely. High-risk IAIs are those that are more likely to cause serious complications or be difficult to treat. One way doctors assess this risk is by using something called the APACE-2 score, which essentially evaluates the severity of your illness based on various factors like your vital signs, lab results, and pre-existing conditions. Think of it as a risk calculator that helps doctors understand how sick you are overall.
Okay, so it's not just the bug itself, but also like your individual health profile that plays a role.
Absolutely. And other factors that can elevate the risk of an IAI include the presence of sepsis, which is a life-threatening response to infection, diffuse peritonitis, imagine widespread inflammation of that lining of your abdomen, your age, any underlying health conditions you might have, and whether source control was delayed.
Source control, what exactly does that mean?
Source control basically means addressing the root cause of the infection. For example, if a ruptured appendix is causing the IAI, surgical removal of the appendix is the source control. The quicker we can control the source, the less chance the infection has to, spread and wreak havoc in that abdominal city of yours.
Wow, so it's like a race against time. Now let's shift gears for a moment and zoom in to the microscopic level. We all know our gut is home to trillions of bacteria. It's like a whole ecosystem down there.
It absolutely is. We call it the gut microbiome, and it plays a crucial role in our health. The stomach has relatively few bacterial residents, but as you move down to the colon, the numbers explode.
Yeah.
We're talking billions of bacteria per milliliter.
So basically, our colon is a bacterial metropolis. But with so many bacteria in the colon, how does our body usually keep things in check?
That's a great question. In a healthy gut, these bacteria actually work in harmony with us. They help us digest food, produce vitamins, and even train our immune system. It's a delicate balance, but when that balance is disrupted, it can open the door for IAIs.
So a healthy gut is crucial for preventing infections.
Precisely. Now, one of the most common and serious consequences of an IAI is something called peritonitis, which is the inflammation of that lining of the abdominal cavity, the peritoneum.
So peritonitis is like the city walls getting inflamed.
Exactly. And it's important to understand that there are different types of peritonitis. Primary peritonitis occurs when bacteria directly infect the peritoneum, often seen in people with liver disease. It can develop seemingly out of nowhere, hence the term spontaneous bacterial peritonitis. Then there's secondary peritonitis, which is more common and arises from a problem within the abdomen, like a perforated ulcer, a burst appendix, or even a complication from surgery.
So depending on the type of peritonitis, the symptoms would probably look pretty different.
You're absolutely right. With primary peritonitis, the onset is usually gradual. You might experience bloating, nausea, vomiting, and some abdominal tenderness. Secondary peritonitis, on the other hand, tends to hit much harder and faster. Think high fever, rapid heartbeat, low blood pressure, and intense abdominal pain. It's a much more urgent situation.
Wow, that sounds incredibly serious. So how do doctors even begin to diagnose peritonitis?
It's a bit like detective work, gathering clues from different sources. First, a thorough medical history and physical exam are crucial. We need to know about your symptoms, any past medical conditions, recent surgeries, and medications. We'll also pay close attention to your vital signs, your temperature, heart rate, and blood pressure, as well as carefully examine your abdomen, checking for tenderness, rigidity, and any signs of that inflammation.
It's like piecing together a puzzle. But what if the physical exam doesn't give us all the answers?
Well, that's where diagnostic tools come in. Imaging studies like ultrasound and CT scans are incredibly helpful. They provide a peek inside your abdomen, allowing us to see the organs and look for any signs of inflammation, abscesses, or other abnormalities.
So ultrasound and CT scans are like our X-ray vision into the abdominal city. And you mentioned something about analyzing the peritoneal fluid. What exactly does that involve?
You're right. Analyzing the peritoneal fluid can provide invaluable information, especially when we suspect peritonitis. It involves a procedure called paracentesis, where a needle is inserted into the abdominal cavity to obtain a sample of fluid. Now, I know that might sound a bit intimidating, but it's a relatively quick and safe procedure.
Okay, I can see how examining the fluid itself would be helpful. What exactly are you looking for?
Well, normal peritoneal fluid is clear and has a low white blood cell count and protein content. But with bacterial peritonitis, the fluid becomes cloudy. The white blood cell count skyrockets, mostly with neutrophils. Protein levels increase. The pH becomes more acidic, and we can actually see bacteria under the microscope.
Wow, that paints a pretty clear picture, so to speak. So we've covered the basics of intra-abdominal infections, what they are, how they're classified, and how they can present clinically. But I have a feeling there's so much more to learn.
Welcome back to Bugs and Beyond.
Where we're continuing our journey through the fascinating world of intra-abdominal infections.
Last time we talked about the different ways IAIs can develop and how they're classified.
Yeah, we even compared the abdomen to a bustling city with different organs representing different neighborhoods.
Right. And we left off talking about peritonitis, that inflammation of the peritoneum, which is essentially the lining of our abdominal city.
Peritonitis definitely sounds serious. Are there other conditions within the abdomen that can lead to these infections?
Absolutely. Let's take appendicitis, for example.
Oh, yeah, I've heard of that.
Yeah.
Isn't that when that little finger-shaped pouch attached to the colon gets inflamed?
Exactly. That little pouch is the appendix, and while its exact function is still somewhat of a mystery, we know that when it gets inflamed, it can cause a lot of trouble. This inflammation, called appendicitis, is usually caused by a blockage, which could be anything from a piece of stool to a foreign object or even a tumor.
So it's like a traffic jam in one of our city's smaller streets.
I like that analogy. And if that traffic jam isn't cleared, the appendix can actually rupture, spilling bacteria into the abdomen and causing a serious infection. That's when we're dealing with a complicated IAI.
That sounds incredibly painful. What happens when an appendix ruptures?
Well, imagine a sewage pipe bursting in our abdominal city. It's not a pretty picture. Bacteria flood the area, causing widespread inflammation and infection. It's a surgical emergency that requires immediate attention.
So it's crucial to catch appendicitis before it reaches that point.
Absolutely. And thankfully, with modern imaging techniques like ultrasound and CT scans, we can often diagnose appendicitis early and perform an appendectomy to remove the inflamed appendix before it ruptures.
I've heard that appendectomies are pretty common.
They are. Around 300,000 are performed in the U.S. each year. And the good news is most appendectomies are done laparoscopically now, which means using tiny incisions and a camera to guide the surgery.
Oh, wow. That's much less invasive than traditional open surgery. Okay, so we've got Exploding appendixes causing trouble in our abdominal city. What about other conditions? You mentioned diverticular disease last time.
Diverticular disease is another common culprit in IAIs. It involves the formation of small pouches called diverticula in the wall of the colon.
Wait, pouches in the colon. That sounds uncomfortable.
You might be surprised to learn that most people with diverticula don't even know they have them. It's incredibly common, especially as we age. By age 80, about 70% of people in the US have diverticulosis, which simply means having these pouches.
Wow, I had no idea. So if they're usually asymptomatic, what's the big deal?
Well, the problem arises when those pouches become inflamed or infected. That's when we get diverticulitis.
So that's where the trouble starts.
Right. Diverticulitis can cause a range of symptoms, including pain, fever, nausea, and changes in bowel habits. And if it's not treated promptly, it can lead to serious complications like abscesses, perforations, and even sepsis, which is a life-threatening condition.
Okay, so we've got exploding appendixes and inflamed pouches in the colon, both of which can lead to IAIs. It seems like there's a lot for doctors to consider when trying to figure out what's causing these infections.
You're absolutely right. Diagnosing IAIs requires a multifaceted approach, starting with a thorough medical history and physical exam. Doctors will want to know about your symptoms, any pre-existing conditions, and any recent surgeries or procedures you've had. They'll also carefully examine your abdomen, checking for tenderness, rigidity, and any signs of peritonitis.
So it's a combination of detective work and a good old-fashioned physical checkup.
Precisely. But we don't stop there. Diagnostic tools play a crucial role as well. Imaging studies like ultrasound and CT scans give us a visual roadmap of your abdomen, allowing us to see the organs and look for any signs of inflammation or abscesses.
So it's like using X-ray vision to peek inside the abdominal city and see what's causing trouble.
Exactly. And we also rely on lab tests. A complete blood count, or CBC, can reveal signs of infection, like an elevated white blood cell count. And blood cultures can help identify the specific bacteria causing the infection, which is crucial for guiding antibiotic treatment.
So imaging helps us see the problem, and blood tests help us pinpoint the culprit.
You got it. And let's not forget about analyzing the peritoneal fluid itself. As we discussed earlier, this fluid can provide valuable clues about the nature of the infection, especially in cases of peritonitis.
Right. We talked about paracentesis last time. That procedure where a needle is inserted into the abdomen to collect a sample of fluid. Can you remind us what doctors are looking for when they analyze this fluid?
Of course, normal peritoneal fluid is clear, with a low white blood cell count and protein content. But when an infection is present, the fluid becomes cloudy, the white blood cell count goes up dramatically, protein levels increase, and we can even see bacteria swimming around under the microscope.
It's like a whole microscopic world in there. So we've talked about how doctors diagnose IAIs, but what about treatment? What can be done to fight these infections?
Treating IAIs typically involves a multi-pronged approach.
Okay, let's unpack that a bit.
First and foremost, we need to control the source of the infection. This often involves surgery, for example, to remove a ruptured appendix or repair a perforated bowel. In some cases, less invasive procedures like draining an abscess might be possible.
So sometimes we need to call in the demolition crew or the plumbers to fix problems in our abdominal city.
Exactly. But alongside source control, we need to fight the infection itself, and that's where antibiotics come in. We typically start with broad-spectrum antibiotics, which target a wide range of bacteria. Then, once we have the results of cultures and see how the patient is responding, we can narrow down the treatment to target the specific bacteria causing the infection.
So it's like sending in the first responders to contain the damage and then calling in the specialists once we know who the enemy is.
That's a great way to put it. And in addition to antibiotics, supportive care is essential. This includes things like intravenous fluids to maintain hydration, pain management, and close monitoring of vital signs.
So it's a comprehensive approach: control the source, fight the infection, and provide support to help a body heal.
Exactly. And remember, early diagnosis and treatment are crucial. The sooner we can intervene, the better the chances of a successful outcome.
This has been super informative. We've covered a lot of ground today, from specific conditions like appendicitis and diverticular disease to the diagnostic process and the multi-pronged approach to treatment.
We have. But there's even more to learn about IAIs.
I'm intrigued. What else should we know about these infections? Welcome back to Bugs and Beyond.
Where we're wrapping up our three-part deep dive into the world of intra-abdominal infections.
It's been quite a journey through the abdominal city, exploring all its potential pitfalls and microscopic mayhem.
Yeah, we've covered a lot of ground from, defining and classifying IAIs to exploring the clinical presentation, diagnosis, and even specific conditions like appendicitis and diverticulitis.
We even talked about the complexities of treatment, like source control, antibiotics, and supportive care. But you mentioned that there's still more to uncover, especially about the challenges doctors face in treating these infections.
You're right. There are definitely challenges when it comes to managing IIs. One of the biggest hurdles we're facing is the rise of antibiotic resistance.
Oh, I've heard a lot about antibiotic resistance in the news lately. How does it specifically impact the treatment of IAIs?
Well, antibiotics are a cornerstone of IAI treatment, but when bacteria develop resistance to these drugs, it becomes much harder to fight the infections effectively.
So it's like our weapons are becoming less powerful against the enemy.
That's a good way to put it, and this resistance is driven by several factors, including the overuse and misuse of antibiotics, both in human and animal medicine.
So it's not just about what we're doing in healthcare settings, but also in agriculture and other areas.
Exactly. Bacteria don't discriminate, and they can easily spread resistance genes amongst themselves, whether they're in animals or humans. It's a complex, interconnected problem.
That's concerning. So what can be done about it? Are we just destined to lose this battle against antibiotic resistance?
Not necessarily. There are a number of strategies we can employ. First and foremost, we need to promote antibiotic stewardship, which means using antibiotics only when they're truly necessary and choosing the most appropriate drug for the specific infection.
So being more careful and strategic about prescribing antibiotics.
Exactly. We also need to educate patients about the importance of taking antibiotics as prescribed and completing the full course, even if they start feeling better before they finish all the pills.
Right, because stopping early can allow the bacteria to develop resistance and make future infections harder to treat.
You got it. And beyond stewardship, we need to invest in research and development of new antibiotics and alternative treatment strategies. Scientists are exploring things like phage therapy, which uses viruses to target and kill bacteria.
Oh, that's interesting. It sounds like we need a multi-pronged approach to combat antibiotic resistance, just like we need a multi-pronged approach for treating IAIs themselves.
Absolutely. It's a complex problem that demands a comprehensive solution.
Okay, so antibiotic resistance is a major hurdle in treating IAIs. Are there any other specific challenges doctors encounter?
Yes, definitely. Another significant challenge is quickly and accurately identifying the source of the infection. Remember, time is of the essence with IAIs, especially those that are complicated or high risk.
Right, because the longer the infection goes untreated, the more damage it can cause and the more difficult it becomes to manage.
Exactly, but pinpointing the source of infection can sometimes be tricky. Even with advanced imaging techniques, we might need to do multiple tests or even exploratory surgery to get a clear picture of what's going on.
So it's like solving a mystery where the clues aren't always obvious.
Precisely. And even when we do identify the source, effectively controlling it can be challenging. Surgery can be complicated or risky, particularly for patients who are already very sick or have other health conditions.
It sounds like a delicate balancing act, weighing the need to treat the infection aggressively with the overall health and well-being of the patient.
That's exactly right. And even after successful source control and antibiotic treatment, patients with IAIs can still experience complications like abscess formation, sepsis, or even death. These infections can be very serious.
It's a sobering reminder that IAIs are not something to take lightly.
You're absolutely right, and it highlights the importance of early recognition, prompt diagnosis, and aggressive treatment. The sooner we can intervene, the better the chances of a positive outcome for the patient.
This deep dive into the world of intra-abdominal infections has been fascinating and honestly a little bit scary. I've learned so much about the complexity of these infections, the challenges doctors face in treating them, and the importance of ongoing research and innovation in this field.
I agree. It's been a great discussion. And remember, knowledge is power. The more we understand about IAIs, the better equipped we are to prevent them, recognize them early, and seek prompt medical attention when necessary.
I couldn't agree more to our listeners. Thank you for joining us on this deep dive into IAIs. We hope you found it informative and engaging. Be sure to subscribe to Bugs and Beyond for more fascinating explorations of the microscopic world. Until next time, stay curious and stay healthy.